going to psychologist because you're ill. That will stop you. If you go into a therapist, you can also go to a therapist for individual wellness and well-being. We're all on the spectrum. And so if you want to move away from the you're not ill, but you want to be a better version of yourself, you can still go to a therapist. Not that you're like, oh, okay, now I'm really ill. Now I'm okay, so it's time now.
And welcome back to Izolami. My name is Natasha.
And my name is Kuma, and we're finally back.
It's like, oh, happy Jen.
I'm just dancing.
No, I've been waiting for us to do a live recording.
Yeah.
An in-person one for a very long time. Yeah. And today we are joined by Mildred, also known as Mimi, who's a clinical psychologist. And we just thought it's fitting for us to have a conversation related to mental health. Because October is Mental Health Awareness Month. And so Mimi's just going to be our guest today. Welcome, Mimi.
Hello, everybody. Thanks, ladies, for having me.
So maybe we should start with you just telling us a bit more about yourself. Yeah. What is it that you love to do? What are you passionate about? What is your body of work?
Sure.
That's my favorite question now.
I love the question.
What is your body of work? Shucks. So yes, I'm a clinical psychologist. I go by the alias emotion activist on social media because I believe that that's my role. So my body of work is to be an activist for emotions, an activist for psychology and conversations around psychology and mental health awareness. So I'm really passionate about that. I believe that there's so many aspects that somebody can use their profession in. So I work clinically and I do lecture as well. So nice. Yes. We need to spread it out. We need to spread the knowledge. We need to change the idea of what psychology is and the stigmas around it and who belongs to the field. And that's why I felt like let's just spread. So yeah, that's what I'm about. I love theater. And I miss theater because of like lockdown. It's like
if we couldn't tell.
I love performance theater. Those are the things I do on the side. I enjoy watching plays
that's
and
so
watching. So that's me.
Awesome. So Mildred, I think a good starting point is always to ask the question, what is mental health, and how do we define it? Because I think we always talk about we have mental health issues, or we don't speak about mental health issues, but what exactly is it?
Yeah, so I think when I think of, a lot of the times we blanket mental health and we think about the illness aspect. So I really feel like mental health is an umbrella term for mental illness and mental well-being. So the two aspects are under mental health, because all the time when somebody says, I suffer from mental health, I'm like, you suffer from mental health? Because health is a good thing. If we think about physical health and physical illness, so I think the same thing, mental health and mental illness as well. So basically, if we talk about the illness aspect, basically somebody has an impairment. So when we talk about mental issues, we think about the way you think, the way you feel, and the way you behave. So it's your cognition, your emotions, and your behaviors. So when you say mental illness, we're talking about impairments in those things, the way you think, the way you behave, or the way you feel. And the most important thing is that it impacts your functioning. So we all have moments where we think not so good, or we feel not so good. But when it starts impacting the way you function, then we say you've probably been diagnosed with a mental illness. And then it cannot be explained by any other thing. So sometimes, if you take a drug, for example, and then you start feeling well, or you start seeing things, that's not mental illness, because it's explained by the drug. It's not explained by you. So it has to also be, nothing else explains these symptoms that you are experiencing. So that's what we talk about mental illness. And then when we talk about mental well-being, it's the opposite side of the spectrum, where we talk about flourishing. We talk about things like Do you have positive feelings, positive relationships? Do you feel like you're feeling accomplished? Do you feel like you've got a community, a sense of community, accomplishment drives, those kind of things? And that's well-being. So, yeah.
I really love the fact that you gave us both spectrums.
Yeah.
It's really important to recognize
I've
that.
never really thought about it.
Never.
I guess everything lives on a spectrum. But
Yes, everything does.
So is it possible for me to have a mental illness, right, and not be aware of it?
Yes. So not be aware of it in terms of not accepting that there's something wrong.
Or not even not knowing that
not knowing
there's
there's
something wrong.
Yes. So if we think about psychotic disorders, so basically with a psychotic disorder, you know, what we understand is someone being mad or shanya, or you know, the person that isn't aware that they are acting in a disorganized or a disordered way. So if we think of psychotic symptoms, you are disorganized in the way from reality. The way you think, the way you talk, the way you behave is not socially acceptable. So that person in the psychotic state would not know that they are having a psychotic episode until they recover from it, and they sometimes can reflect on what had happened.
So what are some of the examples of such a state, of being in such a state?
So schizophrenia. So schizophrenia is a mental illness where the person will be disordered. Sometimes you can have substance-induced psychosis. So it's psychosis induced by a substance, and which is actually, now I'm saying that out loud, what I said earlier in terms of some drugs, you know. So the thing about it is when you remove, the person needs to remove the substance and add some medication, because what we're saying is the substance triggered a psychotic response. So sometimes you can take a drug, for example, and then you see things for a bit, and then after a while you wake up and you're fine. But with somebody with a substance-induced psychotic disorder, they continuously see this, and they need medication to kind of reverse that. So you've got schizophrenia, you've got a substance-induced psychosis, or they could be, they sometimes like something like a delirium, but that's medically caused. So at those states, those people aren't aware. You know, you're not aware that this is what's happening to you. Or let's say bipolar with psychotic symptoms, or depression with psychotic symptoms. All of those things are basically there's a part of you that is away from reality, and you behave in a disorganized way.
So intense.
Very intense.
So I mean, Mildred, I think, you know, we always talk about things from an African perspective, right? On our segments. And, you know, mental health, especially like in the African community, you know, maybe if we can just touch on that to say, you know, there's always a thin line between us accepting it as an African community and us saying, no, it's like a supernatural, you know, type of thing.
Sorry, I want to just say something. I've seen those memes on Twitter. Where the parent is like, when there's so much food in the fridge.
Yes. Why are you depressed? Yes. And I've seen those memes.
We just don't believe it, right?
Yeah.
But I think we're having conversations, and us sitting here with, like, there are people having conversations about it. But is it something that's actually really changing on the ground? Do you think?
Yeah. So I think that's why it's also important that we have conversations like this, because it's only through conversation and exposure that we recognize where westernized medicine can recognize the cultural aspect. So a lot of the time currently something would be called a culture-bound syndrome. That's what the professionals use to explain something that could be seen by medical terms as disorganized or not based on like the normal ranges, but it is actually cultural. And in the community where it is seen, it's accepted. You understand? So for example, a lot of the things like, I mean, some of the psychotic symptoms I was talking about earlier, somebody might be taking it as a cultural thing. So there's a calling, or I need, you know, or it could see it as a spiritual thing where they can say it's religious or possession. So it does happen that a client or a patient can come and there's that mixture between, is this medical or is this cultural? And it's really important that we have these conversations so that we can actually work through it. So on the ground, clinicians are trying. We are trying as professionals, as Africans, of people of color, to educate and have these conversations and learn ourselves, because there's some things that, you know, we need to talk about and then teach. You know, so even me, it's my responsibility as a clinician to learn about certain processes, so that when a patient comes, I'm aware that it exists, and that it's not just them. I'm not going to send them to the psychiatrist, because I don't give medication. Psychiatrists give medication, so that I don't send them off to the psychiatrist and say, okay, fine, this person is you know, mentally ill. There are a couple of psychologists who are traditional healers as well.
Yes, I've seen that.
Which helps the profession tremendously, because then they can teach us, and then we can have conversations and we can learn from their perspective. And similarly, as clinicians who have like the religious aspect, similarly, we can learn, we can speak, we can talk about that kind of thing, whether it's devil possessed or whether, you know, what's happening, so that we can have the conversations, we can learn from each other, and then we don't create the stigma that exists.
That is very interesting.
Now I'm just thinking about how the way in which probably the study of psychology in the past, when we didn't have so many professionals of color, how it probably misunderstood the psychology of Black people, because there were no people who could kind of recognize. There was a lady on a podcast I always listen to, was speaking about how she suffers from depression, I think, with psychotic behaviors, symptoms, but sometimes she would explain certain things to her psychologist, and she's had over 10 psychologists, because she feels like none of them understood her. She would express herself in some way, and it would be taken as like, you know, her psychosis behavior, for me to say correct language, psychotic, but she would recognize the fact that you're not hearing what I am saying, right? So I think maybe the question would be, has there been an improvement in the way that people kind of feel like they are being heard, whether they're seeing a profession of color or not, in terms of kind of the dynamics of our country, it being more people of color than others?
I think we have to ask your viewers. I think this is a comment people could add, that if people really feel that they're heard and understood, you know, from my side, I can't tell. If I think about my therapist, do I feel like she understands me? Because my therapist is not Black. My therapist is white. So I'm now talking to everyone from a patient perspective. Do I feel like she hears me? I think she does. I think she understands some of the specifics, but I don't think it's that for everyone. And that's so it's for your viewership to share and tell us, and then we take that information. I take that information back, and you know, that's why I lecture, because then I can say, shucks, when we're creating, you know, content, or when we're discussing it, or when I'm teaching, what do I need to integrate?
I love that. Guys, please comment and let us know.
So, depression. I mean, we all use the word so loosely, right? And I don't want to say loosely to kind of like water down people's experience, because if you feel depressed, you really do. But what is depression? Like, when do you fully recognize that you're just having a day of sadness, a week of sadness, a month of sadness, or
a life of sadness?
No sadness.
Guys,
or you're just depressed.
And I think it's important, and even as we're laughing, it's like, oh my gosh, like, how do we know, is this my life? This is how it goes. So I think I liked how you said, how do I not know it's not just like a moment of down feelings, because that's happened. We're allowed to feel low. It's an emotion, and it shouldn't be minimized or shamed to have those moments. Okay, so let me talk about it in terms of a clinical perspective. And like I said, speaking on these platforms is interesting because they're different people, so we're not all the same. But we basically look for symptoms. And so depression is not just the low mood. There are other symptoms. For example, appetite, loss of appetite or overeating, sleep, undereating, undersleeping or oversleeping. Don't diagnose yourselves now. Ladies, don't diagnose yourself, please. I'm just giving you a frame.
Yeah.
Okay.
Sure.
Okay. It's a frame. It's a frame. It's a frame.
100%.
So there's appetite, there's your sleep, there's the cognitive factors, so loss of concentration, memory decline. That aspect happens. You know, we're talking about, are you feeling suicidal? We'll ask questions, are you using like substances to cope? So are you over drinking? Are you using any other drugs? When people are using cannabis to sleep and you're using cannabis just to sleep all the time, that's not good. You do not, you know, having sleeping tablets, you know. So yeah, we think about those things. Low mood and depression is also come in the form of irritability. So irritability is not just the sadness, you know. So we look at those symptoms. We look at how long have you presented with those symptoms. So it would be 2 weeks or longer, most days for 2 weeks or longer. And how does it impact your functioning? So now because you are oversleeping, you're late for work, or you can't concentrate, so you're struggling at work. So it has those things, and it cannot be explained by anything else. That's the other thing, that it could not be explained. Because, for example, a grief process, you have those symptoms. Someone passes away, you have those symptoms.
100%.
Or you lose your car, or you lose your job, you have those symptoms. So, you know, that would say, okay, fine, you're depressed because of this. Yes, that's what's triggering the depression. And that, you know, I'm not a big fan. I'm definitely not a big fan. If someone comes to me and they're grieving, I'm not referring them to the psychiatrist, because grief is a normal process. And being sad is a normal process. So we process your sadness, and that's fine. But if you're feeling like after this, I've gotten assistance and nothing is shifting, I'm not functioning, you know, then we say, okay, fine, you've got depression and it's now persistent. So there's like major depression disorder, which has got a time, but then persistent is years of experiencing this, years of impaired functioning. And then we know, okay, fine, someone has got persistent depressive disorders. And it has its modes. So also like something like pregnancy can trigger depressive episode. Sometimes some things like changes in seasons can actually cause depressive episodes. Yeah, there's seasonal depression. So if it goes up and goes down, up and down, there's a lot. There's so much.
But then the question is, I mean, I think a lot of us struggle, you know, to say, when is the right time for me to actually seek professional help? Is it even affordable? Right? I think that's also like the biggest stumbling block for a lot of people, the affordability of it. But what do I do if I'm in between that? Like, I'm sad, I want to speak to someone, or I'm sad because, you know, I'm just grieving. So when is the right time to actually seek out professional help, and is it ever going to be affordable?
So it's a good question in terms of when, and that's why I brought the whole health aspect. Because if you see yourself only going to psychologists because you're ill, that will stop you. If you go into a therapist, you can also go to a therapist for individual wellness and well-being. We're all on the spectrum. And so if you want to move away from the you're not ill, but you want to be a better version of yourself, you can still go to a therapist. Not that you're like, oh, okay, now I'm really ill. Now, okay,
So it's
time now. We're going now.
Yeah.
No, you don't need to do it. You don't have to wait for extremes. But when you are, we have things like, it's a psychological emergency, suicidal thoughts, or being suicidal. So having the thoughts happens, people will have those moments where you think about suicide, but when you start, you know, acting in self-harming behaviors, or you start planning things like your suicide, those are the triggers for us, or warning signs that, okay, fine, it's now time, or now your life is, you know, like your work is declining socially, you know, you're isolated. Isolation is another form of depression. You know, another symptom of depression, you're just struggling to just get through the next day. And, you know, seek assistance. But, you know, you can go even if you're not that, you know, the levels, you know, any moment is a moment to go for therapy. And I agree that the price, the affordability of therapy is expensive in the private sector. It's important to recognize that we have NGOs that give reduced rates when it comes to therapy. So if you go to like a Lifeline or a FAMSA, You've got telephonic structures like SADA. You've got public health sectors. So like I am a session at Helen Joseph. So, you know, you can come to you can get a referral from your GP. They refer you to a government facility that has mental health. And then, you know, facilities, and there's also mental health clinics. You know, there's support groups. So yes, private therapy is expensive, and some therapists have like pro bono slots sometimes, or some therapists can consider reduced rates sometimes. If you're a medical aid and you have some of the severe symptoms that medical aid can pay, they can give you a set number of sessions. So it's all about talking to the people that you know and or you don't know, or reaching out, because something can be done. But I do recognize that it's not a accessible industry. And that's on our side to try and figure out how to make it accessible, because it's just not currently.
And is there anything that you can do in the meantime while you're trying to source out this information? But you're going through the depression right now, right? So, like, what is it that you do? How can your community or your family? Because most of the time we don't even know how to be supportive for people who are going through depression ourselves. You want to give them space, or not give them space. Like, so even in that case, what are the expectations from people? And what are people supposed to, how are we supposed to kind of like be there for each other?
I guess, how do we support each other? We have to have open conversations where they're not filled with shame, because a lot of the times we it feels shameful to say, I've got a problem. Somebody says, "Oh, get over it," or "Deal with yourself," or "My life was harder." You know, look at me. You know, it's not about comparison. We get a lot of that. Get out of it. Sort yourself out. Or like, you know, as black kids, our parents, the whole thing of there's food in the fridge. Why are you depressed? So I think the one thing is, let's have conversations that are non-judgmental. Without, just listen and try to listen. Just be present for each other and hear the issues, and then validate that it's okay to be sad, that it's okay to be it's okay that this is difficult. I would have felt that too. So to validate each other's emotions, and I think if we share honestly about the processes we go through, it encourages the next person, because we all have had a slump and we've all survived it at some point. So if we have conversations where we can say, "Oh, listen, I did this, or I see this person," you know, when we have this kind of conversation, it creates a climate of honesty and a culture of conversations. And I think those are the how we can support each other, a non-judgmental view of problems or people communicating their problems. And then if someone is struggling and you really feel like it's beyond your capacity, then help them find help. So, you know, go on Google psychologists, or look for NGOs, or call people, you know, or send them podcasts, or send them, you know, links like this where people can hear other people share and talk, so that if you can't, because I mean, obviously we all have our cap, and boundaries are really important. You don't need to carry everybody's weight, you know, so you can say, okay, fine, friend or brother or sister or mom or dad, listen, I feel like this is beyond my capacity. Let's try find you someone.
I don't have the bandwidth
I
right
don't
now.
have guys, I don't have it. And I've had people in my practice who have offered to pay for someone's first session, you know, just to give them that kick into the process. You know, I've had people come to me and say, I need you to talk to my brother. I feel like he doesn't understand, and you know, do you have resources that I can share with him, because I'm worried about him? And I'll be like, I do, you know. So I hope that answers your question.
It does.
Yeah.
It does. Thank you.
Because especially around the boundaries, right? Like, you have people that are calling you like, I'm also going through so much. And you know, I think the worst is trying to interact, but you're not fully there, you know, and then it also leaves you. It's just the worst. So having boundaries in place is actually quite important. I actually like that
We're
point.
just afraid to have honest conversations with each other, right? Because someone could call you, but you don't want to be that friend who's not supportive because I'm always supportive of you, or that's what friends do for each other. So you're scared to say, can we talk tomorrow?
Yeah, like not right
I
now.
can't talk right now.
Yeah. I actually, because a lot of people will say, I don't want to be a burden. And so I said, look, if you're an adult and you have adult friends, then ask your adult friends, do they have capacity?
Yeah.
Chomi, do you have capacity for phone call? I really need to talk. And a lot of my friends do that to me. I do that with my friends.
I love that.
Do you have capacity? Because saying someone is a burden, you don't know what the other person's thinking. You're not in control of their thoughts.
Sure.
So you're sitting there and you're shaming yourself when somebody could actually have capacity for you.
Yeah.
So it's just like, oh, you know how we go, oh, are you free next weekend? I want us to go to the restaurant. Friend, do you have capacity for a conversation? I actually need some support. And then
It's not about the food. It's about the conversation. It's what you want to upload.
Exactly, because we use that, right?
Yes.
We'll be like, oh, let's go eat.
Yeah.
And then in the eating, then there's like
Just
tears, and then you're like,
let me tell.
yeah. And then and that's not a bad thing actually. It's
Yeah.
not bad to communicate through food. But now we feel like that's the only way we can share. You know, where you could also just call someone and
It
be
becomes
like,
an expensive exercise.
very I'm sorry, very expensive.
Not a job
Very
for session.
expensive. Yes,
Yeah.
even also the using the alcohol to drown your sorrows. It does cost little.
You know, I was actually telling a friend of mine yesterday to say, when people are super stressed at work and they're like, I'm gonna have a glass of wine before bed or after work, and then what happens if you're stressed for 6 months? Then you're having alcohol every night for 6 months. That's how you become an alcoholic.
Definitely.
So I always try and make it a point to not drink alcohol when I'm super stressed. I'd rather nap or go to the gym, but I don't touch alcohol when I'm stressed. Because I realize, that's how you just took over.
Then you become dysfunctional.
Yeah.
Alcoholics, and we do have people who need a drink and then they get to work, or certain industries are known for certain substances and it's part of the culture. And I'm like, no, we can't accept that. So instead of end up figuring out the whole stress aspect, with the other ways to get help.
Thank you. I really love this conversation and I love your work. You mentioned it earlier, but where can people find you on social media?
So on social media, it's at Emotion Activist. At Emotion Activist, and that's on Instagram mostly, and Facebook and Twitter. Track this Twitter thing.
Yeah.
But yes, at Emotion Activist.
Just
That's
don't get into Twitter wars.
It's another world.
Awesome. But thank you so much, guys. If you have any comments or questions, please let us know. Give us your feedback on the topic of mental health, what it means to you, some of the things that you would want to get clarity on. You can also drop us a comment, and we will be sure that Mildred, Mimi, can definitely give us a response on that.
Yes, because we'll definitely not have the answers. But
Definitely not.
But last week I was not sleeping.
Yeah,
Guys, don't pathologize yourselves.
We actually, in a different segment, potentially we should talk about anxiety.
Yeah.
Overthinking, anxiety. I'm sure there's
My
overthinking, especially.
Listen. Let's not talk about anxiety.
This requires a paid session.
Yo.
Awesome. Thank you so much, guys. Don't forget to like, comment, and subscribe, and then we'll see you in the next video.